And welcome to the July meeting of the Health Overview and Scrutiny Committee. My name's Alison Swaddle. I'm chairing the meeting this evening. We also have with us Jackie Rance, the Vice Chairman of the committee, Sam Akhtar. I haven't got my glasses. Michael Firmager and Barry Patman. Thank you all for attending. Do we have any apologies?
Yes, Councillor Duran and Councillor Chang.
Thank you. Members, do you have any declaration of interest? No, we don't. Right. Do we have any public question? Sorry. Item 12 is the minutes of the previous meeting. Does anybody have any comments or amendments that need to be made to these minutes? No? Okay. Thank you very much for taking such accurate minutes, Madeline. Right. We don't have any public questions this evening, and we have not received any members' questions. Therefore, we can move to item 16, and we are welcoming Clive to the meeting. That's okay. I'm glad you're here. And we're welcoming Councillor Charles Moggetts, who is our lead member for Adult Services, Phil Cunnington, the Deputy Lead Member, and Matt Pope, the Director. Thank you very much for joining us this evening. If you'd like to take us through your adult social care priorities for the coming year, and then I'm sure members will have some questions for you. Thank you, Charles.
Thank you. What I'm proposing to do is basically walk through at a very top line level the strategic priorities for the department, which are listed in the supplementary agenda that was sent out. I'm going to do this at a very top level because obviously this is the direction of travel that we plan to take this year. Would welcome any questions, any comments, and if members wish to actually look at something in more detail, we can obviously deal with that from there. So first of all, care and support procurement framework. This is something basically that has been through executive already and is about establishing a care and support procurement framework to which we have to, all providers actually have to meet minimum standards and have to join. And that's about improving the quality of what we do, developing longer term relationships with providers and driving up the quality of everything we do. So that's about better packages, better relationships going forwards. Second item down, dementia nursing home. Again, something we've talked about before. I certainly remember answering questions on the executive about it, which is a new dementia nursing care home to be at Tootley Depot in Embrook. Over 80 beds to brand new state-of-the-art facility, considerable investment, obviously an improvement in service over what we're currently offering, which will enable more families to keep people who are unfortunate enough to develop dementia in the borough. Now, there's quite a few, moving on to the next line item, voluntary sector things on here. I'm going to try and just explain them all in one because they do all link together. But review of voluntary care sector contracts and procurement exercise. This is something that's been underway for 2 years at least now, basically, and if it wasn't for the dreaded C word, would have been well finished by now. It's about trying to give longer term contracts to our voluntary sector providers with key specifications of what they're actually meant to be doing. So the idea is trying to link the good things the voluntary sector can do. It can start up anywhere, it can start with nothing, it will literally get going straight away, help and put it into places where the council can no longer offer services. Now the next voluntary thing down, so we're going to jump a line down to the launch of the first Voluntary Sector Hub, which is about giving, when you talk to members of the voluntary sector, the one thing often they're lacking, they have all the get up and go that you need, it's just a little bit of knowledge and support with training. So there's two parts of this. This is the first part. The launch of the Voluntary Sector Hub is giving them a fixed base in Wokingham, where several of the key players will be based, providing residents with a single point of entry, providing the voluntary sector with access to each other, training, building knowledge, basically, and working together to come up with solutions. And I think that's it for the voluntary sector for now. So specialist accommodation project is in line with our learning disability strategy, providing clients with safe and high quality housing across the borough, 10 schemes for 46 residents over the next 2 years. Again, a considerable investment in the community and providing facilities for those who need them. Now, next one down is launch of the new voluntary sector mental health service with Mind, something we actually brought forward to deal with the threat, help mitigate from the effects of COVID. And something again I've talked about before. And we've commissioned Mind Oxfordshire, who are literally just about to start, working from central Wokingham, working with our GPs to try and bring proactive projects to help mental health across the borough. And this was brought forward 6 months to help mitigate the effects of COVID. Mental health social care strategy, that is self-explanatory. The health and wellbeing strategies is something that's been, again, going ahead for some time, which is trying to reform the Wellbeing Board. And the aim of that has been, we're currently working on, the NHS obviously classified Wokingham as part of Berkshire West. Now, Berkshire West consists of Reading and obviously West Berks as well. And the NHS has done quite a bit of work actually researching priorities that residents want over the wider area. Now, of course, the wider area, these are very different areas apart from Wokingham. So what we're in the process of doing in the Health and Wellbeing Board at the moment is providing the Wokingham version of that strategy that sits underneath. So we're working with members of the voluntary sector, people from the CCG, to really work through that and provide a Wokingham focus on all of those things. And the real point of that is A, it's a Wokingham message, so we can actually make sure it reflects what our residents want. But B, it gives us the opportunity to hold to account other providers, whether it's the health sector, voluntary sector, and really kind of drive the agenda rather than just watching it go by. Public health services and contract management. There's a whole series of things in there, as you could see: substance misuse contract, healthy child, stop smoking service, really trying to expand what we're doing on a public health basis. Adult social care pathway redesign and implementation, again, something we've been working on for a long while. And again, has been delayed by COVID again. But it's trying to restructure the adult social care and the way it works to improve outcomes for residents. Key things in there, all of you will be familiar with the one front door service that we operate by the CAB, or we really came to the fore from COVID. The idea for that originally came from here, which is what we wanted to do basically with the council services. But obviously the necessity of COVID meant we had to move quickly to actually get going with this with the voluntary sector first. So this is trying to redesign our service to get an improved customer journey, this translation to strength-based working, which you'll see later on this list. Now, what strength-based working means is rather than trying to put people into boxes or define their condition or their needs by this, it's literally trying to look at each person as an individual and create bespoke, tailored packages to help them as much as we can. So the idea of this is making the experience better, making the quality of care better, and really identifying all the person's needs and working with them. And this strength-based working and this one front door system is designed to help achieve that. The next bit is more about strength-based working as well. And then finally, we have the autism strategy on there at the end, which is, again, we've provided strategies on learning disability and several other things. This is basically to provide a strategy for autism to really get on top of that and show how we'll improve service and develop things going forward. So I've tried to keep that very top level, to give you an overview of everything we're looking at. One thing I would say is if you'd have talked to me 2 years ago or 18 months ago about these priorities, you'd have seen many of these things on here. And the net effect, obviously, of COVID has been that this department spent a lot of time getting involved with that over the past year, 18 months. Now, we all know where we think we are today and how we think the future will will play out. But of course, there has to be a big caveat with anything we're saying here, that if there's a sudden need for a lot more activity on behalf of the council, there will be an inevitable effect on what we're actually doing here. So I'm not trying to be negative with those comments, but just realistic about where we are. I'm positive and excited about this program. I feel there's some really good things in there, but obviously, you know, it's subject to the COVID condition remaining as it is or getting better. So that concludes talk from me, but happy to take any questions, and Phil and Matt are also on the call. So yeah, there we are.
Okay, do you have any questions? Oh, Jackie, Sam, Barry, Michael. Right, okay, Jackie, please ask your question.
Thank you. Why are you proposing to build a dementia care home in Wokingham?
Well, thank you, Jackie. I mean, we have an existing facility at Foster's, which is in demand, basically, and is 30, 40 years old now. And it's provided a great service, basically, to residents. But one thing from our strategy that came out 2 years ago was we needed more capacity in this area. So we took the decision to press ahead, basically, and look to build something brand new, a lot larger, where we can deliver modern methods of care and support rather than the methods that were applicable perhaps in the mid to late 80s.
Yeah. And what benefits will it bring to residents?
Well, I think the main benefit, well, two main ones. For people who are actually living in this home, it will enable us to provide a higher level of care and support to them, you know, which is the main thing, because it's modern facilities which are actually up to date. I think for residents and families, it will give us much greater capacity, and sadly, more and more people are developing dementia, so it will enable us to keep residents in borough, to enable them to see more of their families and their loved ones and their support groups. So for me, I mean, it's a positive, good news story. I mean, if we could, we'd build it tomorrow.
Brilliant. Thank you.
Okay, thank you, Charles. Sam.
Good evening, Charles. My question is regards to care contracts. Will there be a provision in the new dementia home for private payers negating the risk of having to move care homes if their funds deplete?
I think, whilst I would say, I mean, obviously everybody's aware of the wider situation with care, which is on a national level. Don't think I'm saying anything too political here, basically, but because parties from all walks of life would accept, basically, that care is underfunded and there needs to be a proper resource for this. I think, you know, obviously people go into these situations with a certain amount of money. We are trying to actually analyse and assess people correctly at the start and as accurately as possible. There is the scope for, if people's funds run out, to try and work out other ways of keeping them in that care location. And, you know, that's something we're actively trying to develop, because, you know, we're actively trying to work constructively with people in that case, if at all possible. So the answer is yes, but it's very much based on individual tailored situations. But obviously it's a symptom of a wider lack of funding for this service. You know, and I think we've widely said all the time I've been in post, that we've asked that central government actually gets on with a proper resolution to adult social care, so that, you know, some of these issues can actually be dealt with.
Thank you, Charles. And my other question was, I note the section on voluntary sector contracts and procurement. What benefits will the voluntary sector get, and what will the residents get from this? Well,
I mean, to be honest, it's hopefully many. I mean, the reason for all of that basically was when we inherited this service, this department, the voluntary sector. A lot of it was on short-term contracts. It wasn't looked at in a structured or strategic way. So what we've been trying to do is look at areas where the council can do well, and look at areas that the voluntary sector can do well. And a perfect example is the mine service that I talked about earlier. We've got a charity that's set up in Oxfordshire, which offers a tip-top service for residents that can be commissioned to come here and fill in a gap where we do not have adequate provision. And, you know, I think, you know, any member could see the effect of the voluntary sector when it works properly and is structured properly from the response to COVID. a response that was set up overnight, literally, where Martin Sloan, who will be familiar to many people, got the key players in a room, and the discussion was, what can you do well? What can you do well? What can you do well? Basically, and giving them all key tasks in their areas of speciality, and we saw how well that worked. So, in direct answers to direct questions, it will mean better funding and longer term relationships, basically, for the voluntary sector to enable them to plan what they're doing, because they know how much money they're going to get. It will then result in growth and entrepreneurship in these areas, because that's what the voluntary sector does well. If it sees a gap, it has the passion and enthusiasm to fill it. And it will result in a better service, basically, and more support for residents, especially as we live in a world where the council does not have unlimited funding. So it can't do all the things it did 15 to 20 years ago. And, coming back to what I was talking about earlier in terms of the redesign of adult social care, part and strength-based working, part of that is if I'm an older person, for example, and I'm presenting with 2 or 3 needs, that rather than, for example, placing me in a home where I'm not dealing with the other needs, because that's the major one, if I have a need for mental health support, bringing in someone like mine to help me with that, and using the voluntary sector to fill gaps that the council cannot, which all results in better quality of life, better service to the resident.
Thank you, Charles.
Thank you, Charles. Thank you, Sam. Michael.
Oh, thank you, Chairman. Hello, Charles. How are you?
Evening, Michael. I'm fine, thank you.
Excellent, good. I note the priority on mental health and mind. What will this do for residents, and how will it work?
Well, I think something, we worked very hard on this to actually commission this, because we were very much aware that we had a gap in this area. What will it do? How will it work? Basically, Mind are set up from a physical base in Wokingham. They're going to be working with all our GPs, and the aim is to diagnose mental health needs, basically, and get support to these people as early as possible across the borough. So this is not something from a physical office, basically, in Wokingham only. It's going to be everywhere across the borough. Now, we looked at this service, we benchmarked them. They'd set up in Oxford, and their record of delivery was very good. So we were very pleased when we managed to get funding for them to set up on an 18-month basis in Wokingham. And obviously, should that 18-month programme go well, and there's no reason to assume it won't, then we'll have another look at this on a longer-term basis. We all know as well the effect COVID has had on people. Many people basically have spent many parts of the last 12 months indoors. The effect of getting people back into normal community or whatever form of normal life they want to live. And this programme was brought forward 6 months specifically to support that. So what will it achieve for residents? In summarising, basically at the start, it fills in a service gap where we didn't have one. It's a service that can be delivered across the borough. It's not you have to go into an office in Wokingham. We'll be working with GPs to deliver this to everyone who needs it. So more support, dealing with the effects of COVID, basically, and improving people's lives and well-being.
Yeah, thank you. I've got another question as well. Why have you selected Mind over other providers? And you did refer to this in your answer as well about benchmarking. How did you benchmark their quality?
We looked at several providers for this. I think why? In my previous answer, I referred to their track record in Oxford, which was very, very successful. But it was more looking at the successful outcomes they have, the volume of people they were talking with, which was very significant, and the actual people who were, and not. We sometimes have these discussions basically within ASC, and as I'm sure people who've worked on this call have come across health before, they talk about interventions and outcomes, and it's very easy to measure basically, I might be a GP and I might see, for example, 500 people a day, basically, but the quality of those people, those interactions will be very poor. But one thing that came across very clearly from Mind was that the survey of the people they've dealt with and the customer feedback was very, very, very positive. So we we were really keen to associate with them because we could see they had a track record of making a positive difference for people's lives.
Thank you very much for that. Thank you.
Thank you, Michael. Thank you, Charles. Barry.
Yes, thank you, Chairman. How does the work of the Health and Wellbeing Board benefit local residents, and what input does it have on the wellbeing strategy?
Okay. Well, thank you, Barry. Well, the Health and Wellbeing Board, forgive me if some of you know this, but it's a meeting that takes place regularly. I'm the current chair. Debbie Milligan, who's a GP from Arborfield, and is on the CCG as the deputy chair. It's a group of people basically from across the borough. John Halsall sits on it, Clive Jones, basically other Katie Summers from the CCG, members of the voluntary sector. And the aim of it is it's a format basically where key parts of key concerns, it's meant to be feeding residents' concerns into the thoughts of these people and actually directing strategy so it reflects residents' concerns. So principally what we're trying to do at the moment, as I said earlier, is the Wokingham Wellbeing strategy, which is the five major things that came up from market research, and making sure that we get a document that we can then hold all the key players to account to. So that's people from the CCG, that's people from within the NHS, that's GPs, things like that. Now, if we're successful with this, it will give a forum where we can really reflect residents' concerns and say to the people who are in control of them, well, look, you're meant to be responsible for this. Your report said you're meant to be seeing, I don't know, 90% success outcome here, and you're only achieving 75. What are you going to do to change that? And it's on a Wokingham level. So this is not some super inflated piece of NHS policy which sits up there somewhere. It's basically reflected by the needs of the people of Wokingham. So in summary, to answer your question, what do I hope this will do? It will give us the ability to get some say on things that are outside our control, not commissioned by us, but really to hold these people responsible when things go wrong, but also to thank them and praise them when they go right.
Thank you. I've got one other question, and that is related to the moving to the strengths-based working. You did mention it a bit earlier, but perhaps you could give me some idea of what sort of advantage it's likely to bring to us.
Okay, well, strength-based practice, it's a modern way of trying to look at care, and it really is trying to focus on the individual and what matters to that individual. So instead of looking at somebody and trying to diagnose them to a pre-made condition, it's looking at basically what their needs are and how they can grow from it. So what it would involve is at an early stage of social work, focusing on what the person needs, what they want to achieve, and what outcomes they hope to get from the interaction, exploring their personal network of family, friends, neighbours, and the wider community. And so examples of that, it might mean supporting them to access groups of people who have shared interests, talking again about the voluntary sector, connecting people to voluntary and community services. So again, to touch on what I said earlier, that if I'm somebody basically, and I'm somebody we're assessing their needs, trying to understand basically how to help them. And for example, say it's assessed that I have a mental health need. Rather than the council trying to do it or referring it to the GP, I'd be referred to Mind, and Mind would be asked to assist me. It's bringing in technology at home to help people, tailored technology though, to help people stay at home and give them the support they need to live at home. And trying to regable and regain skills basically if they've been lost along the way, again to support independent living. But I think the easiest way I can summarize this is, rather than you've got this or you've got that or you've got that and therefore you need this, it's very much about tailored bespoke solutions. And what does that mean in reality? It means a better quality of life for the people we're trying to help. Well, that's the aim of the exercise anyway.
Okay. Thank you.
Okay. Thank you, Charles. I'd like to learn more about the specialist accommodation project. So you've mentioned 10 new schemes for 46 residents over a 2-year period. Are these replacement housing, or is it brand new? And could you tell me a bit more about the reasons for developing this project?
Sure. I mean, it's again trying to support people living out in the community, and it came up as a key part of the learning disability strategy. And the idea was to provide basically clients, people we're trying to help, with safe and high quality housing solutions across the borough. So it tends to be small houses, sometimes owned by the council, sometimes not. We've given the support that people need to actually live there. So it's all new, none of it's replacement. And at the moment, we're working on 10 schemes. And the aim is to provide housing for 46 residents over the next 2 years. Implement this program's underway and is ongoing, and the aim is to have it complete within the next 2 years.
Thank you. I also wanted to ask about the first voluntary sector hub, and if you could explain what the benefits are, both to the voluntary sector, but also to the council.
Sure. Well, I mean, I've already talked earlier about the our appreciation and the way we try and work with the voluntary sector. And the ideal world is that we will do the core services basically, and we'll focus on them, and we'll bring in the voluntary sector to do things on top of that. So the voluntary sector hub, the idea we originally came from something we've seen that works very well in Bracknell, where they've established this, and the feedback we'd have basically from the members of the voluntary sector involved there has been very positive. So it's in Montague House in Wokingham, so right next door to the CAB. I think off the top of my head, and I know Matt's on this call, please correct me if I'm wrong, but we've got space for 12 people there in total. There's still all the key players from the voluntary sector will be there. And the aim is it's a central point where people can go in and to put these charities together, basically where, for use as a training base, to support each other, to bring ideas to each other, and to provide one point of contact. And this is very much the first part of it, as in a physical bricks and mortar service. The longer term idea is to create some kind of online presence as well, where they can use what they use that to promote themselves and their activities and get a wider base for what they do. I don't recall members of this committee being present, but just before COVID, we ran an event in Sindlesham Court called Designing Our Neighbourhoods, where we got, oh gosh, I'm trying to remember, I think 120 or 140 people from across the community, councillors, parish councillors, NHS people, people from the Royal Berks, people from the voluntary sector. The one thing that came out of that was talking to people about the communities and where they live and what they need, was there's actually a huge amount of services basically and options for people in this country, in Wokingham, to improve their health and well-being, whether they want to take up more activity, or they want to get support with something, but there's no central place you can find out any of this, apart from asking questions basically, or networking. So the aim of all of this kind of overarching thing was to enable people to network more, enable people to find out what services are about and promote each other, because if the services are there, let's help people actually find them and improve what the offer is.
That's a really exciting initiative. Thank you for sharing, Charles. Clive, do you have a question?
I do, Alison. Yeah, I did put my hand up earlier, but I don't think you saw me. Charles, you know that I have a very high regard for you in the role that you do, because I've told you that before. But tonight, did you have any notice of any of those questions that you've just answered?
I think what I will say, thank you first of all for that. I think obviously, did I have any notice of those questions? I think what I would say is, looking at the subjects on here, I could have anticipated what the key questions were going to be. Let's put it that way.
Okay, just looked like they all came from the same list. But I've got a few questions. This 80-bed dementia home that we're looking at, are we assuming that this will take private people rather than people who are paid for by the borough? Because it sounded from one of your previous answers that it was the private sector that we were really going.
The aim is, first of all, Clive, that it takes people from the borough. The idea is that, as I said in the first answer, that Foster's is coming towards the end of its life. We have a growing need for people in the borough. And part of the reason for doing this was to get control, basically. We needed to do it because we needed to replace Foster's. We needed to do it because we needed to expand capacity. But part of the reason for it was to also have control over basically where people went. Am I going to say to you that if we're ever not quite full or need to fill up, we would not say no to other admissions? No, I'm not, basically. But the first priority is for Wokingham residents, and obviously those who need care, who can't provide it, need support, sorry, I should say, which can't be provided directly.
Right. So it is really for people who can pay first, rather than people who are having their fees paid for by us.
No. Let me be clear. It's for people basically in the first instance who we are supporting. And we, as in Wokingham Borough Council, I mean.
Okay, thank you very much for that confirmation. CAB, they I think are quite worried at the moment that there's still going to be quite a bit of fallout from COVID-19, and that they might have been very busy in the last year or so, but the emphasis is going to be very much on mental health issues in the next year, and they may well go on into future years. Are we working especially with them, planning for that over the next 6, 9, 12 months?
I think what I would say, Clive, is personally I'm quite apprehensive of this because we are sailing into a completely unknown landscape, and we can predict the world as we think it will be, but we've got no way of knowing how it will be. The answer is, basically we are talking to the CAB regularly. They're one of our key partners. We are talking to all members of the voluntary sector. We've just added recently, to kind of strengthen their voice, added another member of the voluntary sector to the Health and Wellbeing Board, Nick Fellows from the Wokingham Volunteer Centre, specifically to strengthen their voice. We're in an unknown world, to be frank with you, and we're going to keep talking to these people and looking and adjusting as we go. I would expect we're facing two major things, which is the mental health issue that you referred to, and there's also the physical side of trying to get people who've been either through choice or through health reasons or all those other things largely shut away for 12 to 18 months to coming back into the world is the wrong expression, but also trying to recover parts of their former lives and the independence that goes with it.
Are we going to put an advert again in the Borough News advising people that if they have issues to contact the One Front Door and CAB, and indeed this first the Voluntary Sector Hub that you're setting up?
I'm not, well, I'll have to get back to you on that, Clive. I'm not aware of a plan to do one at the moment, basically. However, if we think it's necessary, we will. But what I will do, if you'll allow me, is I will check with the officers on that point and come back to you, rather, Chairman, on this next few days.
Yeah, that will be fine, because we did something with the CAB in early where a small A5 leaflet was delivered to a lot of houses, and I think the take-up has been pretty good, really.
Yeah, I mean, I'm game for anything, basically, that works and actually delivers the result. So I think I will take up your point with the officers, basically, and we'll come back to you on the come back to you via Alison in the next few days.
I got one more question on CAB. You no doubt know that they are trying to put on the road a mobile unit
Mm.
so that it can go to different areas of the borough and be in car parks at the end of a road and that sort of thing, so people can, instead of having to come into the town, go and use this mobile unit. Is there, or I'm sure you've been approached, or I would imagine you've been approached for some help with funding for it. Do you know if you were, and if so, how much did you give?
I can't, well, basically we have a long-term contract with the CAB. So, you know, off the top of my head, I don't know what the funding arrangement is for the specific thing you mentioned. But again, I'm more than happy to ask the question and come back to you via Alison. But, you know, I should say, you know, based on the discussion we had about Mind earlier, you know, obviously that's a very good idea, taking the service out to the further parts of the community where not necessarily it's easy for people to access.
Yeah, I agree with you very much there. I would suspect that this wasn't covered in the original financial deal that was, I think, done last year, because I think this is something that they've just thought of over the last few months, but I'm not 100% sure. Anyway, thanks very much.
Not at all. Can I just make one correction, Chairman, basically, if I may? That I said earlier we were closing Foster's. That's, of course, complete nonsense and shows I've had a hard day at work. It's Suffolk Lodge.
Actually, Alison, I was going to ask a question about Foster's.
Yeah, well, I did
You've
wonder.
just reminded me. Is it
Our award-winning residential place in Woodley, and we're going to close it? Surely not. Do you have another question, Clive?
Mistake.
Yeah, is it full, Charles, Foster's, or the replacement of Foster's?
Is it full? Well, we've not built it yet, so not yet.
Right. There is a building there that has replaced the old Foster's, isn't there?
Oh, that is still called Foster's.
Yeah.
Right. Well, again, Clive, I'm going to give you the same answer, I'm afraid. I'll find out to you and come back via the chairperson tomorrow.
And just one other point. I'm not a member of the Health and Wellbeing Board. You're mixing me up with David Hare.
Oh, gosh.
I'm a lot younger than him.
Yeah, yes, yes. And have less extravagant clothing taste, Clive.
Charles, could I just ask about the autism strategy? I'm very pleased to see that we're going to have a strategy of a plan of support for adults with autism, and it's going for consultation, aiming to be completed by April 2022. If it was to come to HOSC for us to scrutinise, would it be appropriate to be on our March meeting? Would that be good timing before it went to exec, so that we could add some value?
Well, what I was going to suggest to you, Alison, is that after this, we're obviously more than happy to bring things at the right time to you. But perhaps if you, myself and Matt could get together for a meeting and we could go through all our programme of forward work and agree times, we're more than happy to bring things for scrutiny, but obviously it's important it's the right time. And I think we were quite keen. I mentioned to you earlier, basically, about the Berkshire Wellbeing, the working Wellbeing plan we're working on. We'd be quite keen for you guys to have a good look at things like this as well, because our work doesn't just involve what the council does. As I said, public health has a responsibility which is much wider than that. So I'd welcome a discussion with you outside of this, for you to obviously report back and agree with your group at your convenience.
Yes, let's set that up. Thank you very much, Charles, and thank you, Matt, for your support there. Does anybody have any other question they wanted to ask? Oh, Sam.
And just one last question. First of all, well done on the launch of the first voluntary sector hub. Just from the other side of the fence with regards to people volunteering, I always have residents ask me all the time, I'd love to volunteer. are there any good volunteering opportunities in the borough? Could this provide a good central place for people looking for those volunteering opportunities to go and find a sort of a central point to look at where the need is?
Well, absolutely, Sam. I mean, I would say to you and any other member, we of course support the voluntary sector. There is the person to talk to is Nick Fellows of the Wokingham Volunteer Centre, who I believe will be based from this physical hub, so at Montague House. They currently an existing charity. They do great work with us, and anybody at all who wants to volunteer, direct them there, and they can allocate them something which suits their speciality, their interest, their experience.
Thanks, Charles.
Matt.
Hi, yeah, I was just to say, I think some of those questions that you were going to take away, Charles, predominantly from Clive, I might be able to pick up some of those now directly. Did you make a note?
Yes, Clive was asking basically, we'd run previously adverts in promoting One Front Door for the CAB.
Yeah. And
he was asking whether we were planning to do something like that in the future. He was also asking, the CAB have this new service where they're taking a van out to parts of the community to obviously promote their services, whether that was included in the current funding contract, basically, and if so, did we know how much it would cost and were we funding it? And the final one was regarding Foster's, is it full? And Clive, please correct me if I've omitted anything.
Okay, so I don't have, in reverse order, I suppose, I don't have exact occupancy figures for Foster's, which we can get, but I am, I know it's full or nearly full, so we can get exact occupancy for that. In terms of the van, I know I've got a meeting coming up with Jake to have a chat about that. I wasn't aware that there was a funding request, but certainly something we're really supportive of, so I'll have that conversation with Jake about how we make that happen. And then in terms of One Front Door publicity, we've done quite a bit. That is ongoing, and obviously we'll pull together a plan for communicating the hub, and basically any ideas that work, such as a leaflet drop and things like that. Let's gather them up and we'll put them in that plan, because whatever works really. So we'll cover that off. Okay, I think hopefully that's answered, or given a bit more of an answer to those questions.
Yeah, thank you very much.
Okay, thank you very much. Moving to item 17, which is health scrutiny arrangements across Buckinghamshire, Oxfordshire and Berkshire West integrated care system. So we're being asked to receive a report regarding this, and there are 3 recommendations. Matt, do you want to explain to us a little bit more about this, or are you doing this, Charles?
I think if I lead on it, and Matt, if there's anything you want to come in on, please do so. I think I'll start at the beginning, but I'll try and keep this as simple as possible in case some of you have heard it before. That you'll all be aware of the government's planned reforms to abolish CCGs and set up ICSs, which is a wider, more regional version of NHS structure. Now, the proposal at the moment is that we, as in Wokingham, as part of West Berkshire, join BOB, which is Berkshire, Oxfordshire and Buckinghamshire. Now, the proposal that's before you is the report that appeared about setting up a joint scrutiny committee across BOB. Now, so that is what it is. Now, basically, I think our position on this, myself, Matt, Phil, and indeed the leader, John Halsall, is that we were really intrinsically not very happy with the idea of this, because moving scrutiny away from Wokingham to some more regional body did not feel right to us. But we kind of made a considered decision on it, that if we weren't involved in this committee, it could just proceed without us anyway, so we would have no voice on it. it was only likely to meet a couple of times a year. And, that was the basic level of that. I had a couple of meetings probably, 4 or 5 months ago with my opposite numbers in Reading and West Berkshire, and they feel exactly the same way about it as we do. And I think basically the agreement from that was that the committee, the joint body, should only be used for scrutinising really regional things that, such as, for example, major changes to hospitals that would never work that way. And it's not just simply a shop for health to pass things through and just avoid having to go to 10 meetings and just try and do it in one. Now, there is, I would say, you'll have seen reference in the document to a toolkit, which is what decides what goes to the joint HOSC rather than goes down at the local level. We obviously take the view that as little as possible should go to the joint HOSC and that Wokingham should have a voice in as much as possible. And that toolkit has to be decided, but every council gets the right to sign this off. So basically the toolkit's not decided, but everybody has to accept it. So we have the ability to negotiate on that. One thing I would say, though, however, is this is all in a bit of a state of flux at the moment because MPs in Surrey, the way this was originally structured is that we in West Berkshire were part of Bob, and East Berkshire was going to be linked with Frimley Park in an ICS there. But Surrey County Council and MPs in Surrey have been lobbying very hard that Frimley goes into Surrey, which obviously means East Berkshire has no home. So the discussion that has come from that is that if Frimley Park does go into Surrey, but we will come out of Bob and join East Berkshire in a Berkshire ICS. So obviously all of this is slightly hypothetical at the moment because we're waiting for the Secretary of State, the new one, to make his mind up on how that's all going to pan out. Though we expect the answer to that fairly shortly. So I would say that's my view on this. Well, it's not my view, it's Matt's view, it's Phil's view, it's John Halsell's view as well. We're all on the same page on it, but none of this may come to pass, to be frank, because if we do end up with Berkshire, this will change.
So are you still recommending that we support the proposal and that it goes to full council?
To be honest, Alison, I don't think we can at the moment because this could be history by next week, unless Matt feels strongly otherwise.
Well, I suppose it's about, it's true that the ICS footprint may change, and there hasn't been an announcement on that. But I think, and Madeline might be able to help here, from a timing point of view, we need to improve this today so that it can go to full council, so that we can be part of this joint committee if it indeed starts. So if we delayed it, we might not be able to hit that timescale, I don't think. Madeline, is that right?
That is correct. I mean, it could be delayed and go to a later council meeting, but the plan was to go to July because we are the last council to sign up if we were to sign up.
So I think the if it's okay with the committee and everyone else, I think the recommendation is to approve this way of going forward, with the caveat that if the ICS boundaries did change, then we would revisit, so that not to create delay.
I think what I would say, Alison, is I'm comfortable with all of that, but it's not something a structure we particularly like, but it's one we will accept and we will work with if it comes to pass.
Okay, I've got some members indicating they'd like to speak. Clive, then Michael.
Thank you, Alison. I don't recall too many times when a overview and scrutiny committee has recommended something to the full council for them to approve something. Now, maybe it is just my memory. I'm wrong. Madeline's putting her hand up, so I think possibly I am.
In this instance, it's because you're recommending the establishment of a new committee. So it has to be to go through council, but because it's a joint committee, the health scrutiny has to approve it first for it to go into council. So it's quite a specific situation.
Okay, thanks. So I'm sort of half right. Okay. Hello there. Yeah, I'm just sort of wondering on this one, Charles, because you made reference to it being on the regional basis, this new committee, if it does go ahead, and obviously we don't know, and you know, it could go to full council and then it could get pulled if it's all going to be irrelevant. But I'm just sort of wondering, assuming it all goes ahead and it does actually happen, and you're on the regional basis, my great fear is it could dilute HOSC here as it is. I just wonder what view you might have on that.
I think I would say, Michael, I mean, the way it would work on a regional, it would go to a regional decision basis. And, you know, that was our bit of it. You know, we're responsible to the people of Wokingham. We're meant to represent their voices. And, you know, if we end up in a room with, you know, Oxfordshire and Buckinghamshire, who will have entirely different priorities, and rightly so, then, you know, our voice gets very small, basically, and gets... but we ended up in a situation with this, basically, where it can proceed by the legislation, whether we agree to join it or not. So we took the view, basically, that, you know, the best thing to do was to try and keep as many decisions as possible with HOSC here in Wokingham, and as few decisions as possible, and only the ones that really have to go into this this committee. And as I said earlier, the toolkit, which is what decides what goes up to this committee and what's decided locally, all councils have to sign up to. So, you know, the next stage, once we, well, assuming we agree to this, yeah, and assuming it goes forward, is the negotiation of that toolkit. As I said, I had a couple of my meetings with my equivalent numbers in Reading and West Berkshire earlier in the year, and they were in mind of exactly of the same mind, that as little as possible goes to this, and, you know, it's only really stuff that, you know, such as hospital services or the whole area. But obviously, coming back to the point which we touched upon earlier, it would make far more sense, probably as a geographical area, that instead of being in Bob, we were in a Berkshire ICS, because we have much more in common with the other Berkshire authorities than, say, Oxfordshire or Buckinghamshire.
Yeah, I mean, it's a very good point. I think it's going to get too big as well, and that could get unwieldy, but we'll have to wait and see. Just on the another question on the side, it says in the papers that we've got that the meetings will be undertaken by one local authority on a permanent basis and host the meetings when we obviously can do sort of proper meetings, I think. I'm just wondering how that authority would be chosen.
My understanding is, well, what I would say is, sorry, to come to that in a second, but one thing I did agree that if Bob does go forward, basically, with my two colleagues from West Berks and Reading, is that we would have pre-meetings before each meeting to agree a common kind of West Berkshire position, so that our votes all added together and all actually represented something. My understanding on that, and Madeline, please correct me if I've got this wrong, was basically it was by vote and by rotation. Basically, that was how it was decided.
Okay, thank you.
Okay, so looking on page 21, we'd have two members of JOSC from Wokingham and politically balanced. And I assume those would need to be drawn from council members who are not exec or audit. Would that be the same situation?
Probably a question for Madeline rather than me.
Yes, that is correct. And it would probably be preferable if there were members of HOSC, but it's not completely necessary.
Okay, thank you. Oh, Clive.
Thank you, Alison. That was partly what I was going to ask. It says it needs to be politically balanced. Does that mean it will be one from one party and one from another?
That is the suggestion, yes. So one Conservative, one Liberal Democrat.
Okay, all right. Thanks very much. I agree with an awful lot what you said, Charles. Got real reservations about this, but I would hope that if it does go ahead, we can still get the hospital to come here and all of the other people that we get on a regular yearly 18-month basis and still ask them questions, because I think just twice a year somewhere remote, and as you say, when we're also talking about Oxfordshire and Buckinghamshire, that voice is really going to be pretty diluted.
Yeah, and this was our big fear about all of this, that if we weren't careful, this could just end up from an excuse it could just exist from the NHS to make life easy, to just pass things they want through with as little scrutiny as possible. I mean, rest assured, basically, I've been quite frank about my reservations about all of this, basically. But, you know, if this does go ahead, we will work with this in the most constructive way possible. And we will try to make this work as best as possible for the residents of Wokingham. But it's going to need quite a bit of pre-planning, you know, meetings with West Berkshire and Reading beforehand to agree positions. And, you know, it's going to involve quite a lot of organisation. I mean, you know, I'm keeping everything crossed basically for a Berkshire ICS, which I think is much more manageable, but we have to wait and see, and that's not something we can obviously control.
I assume that you've actually pushed back.
Oh, yes.
Yeah.
Oh, yeah.
Yeah.
I saw a letter that went to the Secretary of State last week. I mean, but the Berkshire authorities, this was subject of at least one Berkshire leaders meeting, which I attended just to talk about this. But the Berkshire authorities are slightly split on this, because East Berkshire obviously want to stay part of Frimley Park as things stand currently, because their GPs and their health service people are lobbying them very hard for that, because obviously Frimley Park is an excellent hospital and is very well set up. But there was a letter that went to the Secretary of State either last week or the week before, signed by all of the leaders from Berkshire, and it very specifically said that the basic tone of it was the East Berkshire people were saying they very much wanted Frimley, but if Frimley wasn't to be, they very much wanted a Berkshire ICS, and they did not want all to be dropped in Bob, because basically it's even worse than if you're in Bracknell and Slough or the Royal Borough, to be having to negotiate healthcare arrangements with people from Buckinghamshire and Oxfordshire.
Is Frimley Park still joined up with Wexham Park, which I think is probably just over the Buckingham border?
Could I? I don't know the answer.
Maybe
I don't know. Well, Phil Cunnington might know the answer to that if Matt doesn't, so I'll ask one of them to get involved.
Happy to speak, Charles, if you like. Yes, Wexham Park is still part of the Frimley arrangement, and you're right, it's right on the border of Buckinghamshire. So but having said that, that is right at the southeast of that Bob region. So it's the closest touch we have, and it's a long way away from Frimley, and it's certainly a long way from us.
I should have explained, Clive. Phil works for the Frimley Park CCG part of it, so he's obviously quite closer to that than I am. Let's put it that way.
And I've just got one more question, if that's okay. Health Watch are supposed to have a position on this group. Does that mean it'd be Reading Health Watch or Wokingham Health Watch? And have we talked to Wokingham to see if they want to have a place on there?
No, not at this stage. I mean, I have spoken to Health Watch about this. They share our view about all of this, but I've not had the discussion about the internal arrangements how they plan to deal with it. But, you know, obviously, if this goes forward, it will be one thing, basically, that we will take up.
Thank you.
Right. So, members, there are 3 recommendations on page 11. May I propose that we support this proposal, and we recommend that full council delegate scrutiny of health issues to the Joint Health Overview and Scrutiny Committee and recommend full council approves the terms of reference. Can we add the caveat, Madeline, that if the ICS boundaries change, then that this should be revisited by the full council? Appropriate. Yeah. Okay, members, if you're in favour, would you raise your hands? Okay, thank you very much. That's all in favour. Thank you very much, Matt, and thank you, Charles, and thank you, Phil.
Good night.
Evening.
Good night.
So I think we can say good night to you. Thank you. Okay, the next item on the agenda, item 18, we would normally be looking forward to an update on the work of Health Watch. Unfortunately, they haven't been able to send anybody along this evening, so we're going to, if you've got any questions on the report that we've received, pages 23 to 46, if you could send those to Madeline, and we'll send them on to Health Watch and then share the answers with everybody on the committee. So we're moving to item 19, page 47, looking at the forward programme. In light of the priorities presented to us by Matt and Charles, is there anything anyone would like to suggest that we add to our forward programme? Yeah. Clive?
I was just having my hand up because I wanted to say something about Health Watch.
Oh, please go ahead.
That's all right. I just want us to note that they continue to do a really good job for us. And you know, they've given these details here on page 5 of their report, 27 of the agenda pack, and it's all really good. They are really working very hard as our eyes and ears for councillors and the council, and I think that we should recognise it. We do at most meetings. I think it would be good if we can do that now.
Yeah, I absolutely echo that. They do amazing work. It's a very small team, a lot of volunteers. I think we can all understand that they've probably got something on and not able to come this evening. And they always really welcome our interest and our questions. So please do ask anything that you wanted to know a little bit more of, and we just hope we'll be able to talk to Jim again at the next meeting. Thank you for that, Clive. Going back to the forward programme, is there anything anybody wanted to suggest that we should be adding? Okay, so I will be meeting with Charles and Matt to go through some of their priorities and the things that they are keen for us to scrutinise. As I highlighted, I think the strategy for adults with autism is something that I would like to add, possibly in March or possibly in January. I think we've got a very full meeting coming up in September when we're looking at Optalis, dentistry provision, public toilet provision, the health consultation report and Health Watch. No, not seeing any hands up. Is there anything anybody else wanted to raise? No. Okay, well, with that, I'll say thank you very much to Madeline. Thank you to Anne for working the wonders of technology for us this evening. And I will close the meeting. Thank you, members.